Ever feel like your body, it's just not cooperating? A
Yeah.
little betrayal, a nagging ache pops up, or a stiffness, or maybe that familiar twinge just won't quit.
Yeah,
It's like suddenly, your body isn't the invincible machine you thought it was.
yeah, I know what you mean.
Well, get ready, because today we're going deep, deep into the world of physiotherapy in orthopedics. It's pretty fascinating stuff, where, let's say, broken bodies, they're rebuilt, and movement, well, it becomes medicine.
It really is like unlocking these secrets, the secrets to restore that natural ability of your body to move gracefully, powerfully.
You said it, a symphony of movement. That's a great way to put it. It sounds pretty vital to orthopedic care, right? Like it works hand in hand with surgery and other interventions.
Absolutely. You know, it's interesting you say that because there's this really strong belief that physiotherapy, it should be an integral part of the entire orthopedic journey from, like prepping for surgery all the way to recovery afterwards and everything in between, really.
So it's like this holistic approach. You're addressing the whole person, not just a single injury.
Exactly. Now, let's unpack the challenges that physiotherapy tackles in orthopedics. When we talk about trauma, we're looking at three main areas where things can go wrong, you could say: soft tissues, joints, and fractures.
Okay, so it's kind of like a domino effect,
Yes.
right? One thing leads to another. Can you elaborate on how these areas, how they're all connected?
Sure, sure. Imagine, let's say you injure a muscle or a tendon, maybe a ligament. Those are your soft tissues. Now, if that injury isn't addressed properly, the muscle can weaken and it can actually shrink, which is what we call muscle atrophy. Now, let's bring a joint into the picture. You might experience stiffness, limited range of motion, and then, of course, you have fractures. Often, those require immobilization to heal.
Right, and that immobilization, while necessary, it can lead to further complications, right?
You're absolutely right. It can cause joints to stiffen up even more and muscles to weaken further. That's where physiotherapy, that's where it steps in to break this cycle. It helps you strengthen those weakened muscles, improve joint mobility, and it guides you back safely and effectively to activity.
It's like bringing that symphony of movement back, getting
Yeah.
the instruments in tune and playing together again.
Exactly. The goal is pain-free movement and function so you can get back to, well, the things you love doing, right? And one of the tools we use in physiotherapy is heat therapy.
Heat therapy. Now, that sounds pretty straightforward,
Yeah.
but I'm guessing there's got to be more to it than just, slapping on a heating pad, right?
You're right. It's not just about, simple warmth. It's about harnessing the power of heat to actually trigger specific responses in your body. Think of it as a catalyst for healing.
Okay, I'm intrigued. Break it down for me. How does heat actually promote healing?
When you apply heat to your skin, it activates these special nerve endings. They're called thermoreceptors, and they're like tiny temperature sensors. They send signals to your brain, and that's what triggers a whole chain of events. One of the key effects is vasodilation. Basically, it's like widening the highways in your body so more blood can flow to the injured area.
So it's like opening the floodgates, right? Delivering all that oxygen and nutrients that are essential for repair.
That's a great analogy. Increased blood flow also helps flush out waste products, which further aids the healing process. And heat also has a direct effect on muscles. It causes them to relax, reduces spasms, which are often a big part of pain and stiffness.
It's amazing, right? Something as simple as heat can have these profound effects on the body. So how is heat therapy usually applied? Are we talking like hot baths, heating pads, those little heat patches?
There's actually a pretty wide range of methods. Each has its own benefits, and, it depends on the condition and the area that needs to be treated. But generally, heat is applied for about 20 minutes, though it can vary. Now, we categorize heat therapy as either superficial or deep. So superficial heat targets the skin and the tissues just below the surface, while deep heat penetrates further into muscles, tendons, even bones.
So it's like choosing the right tool for the job, depending on how deep you need that heat to penetrate.
Exactly. Now, before we jump into the specific types of heat therapy, I do want to quickly acknowledge the London HeartbeatsZ Academy in the UK. They've been really exceptional in their support in this area. They offer over 140 healthcare courses, including a ton of info on physiotherapy. If you're interested in learning more, I really recommend checking them out. You can find them on Facebook, Instagram, Spotify, and YouTube, all free with regular updates. Don't miss out. Subscribe today.
Wow, what a fantastic resource. Okay, back to heat therapy. Let's start with the superficial kind. What are some of the common methods used?
Well, some of the ones you might encounter are hydrocollator packs, infrared rays, paraffin baths. There are also, the more basic options like hot packs and hot water bottles, but let's focus on those more specialized techniques.
Sounds good. What are hydrocollator packs?
These are really fascinating. They're basically packs filled with a special gel, usually silica gel, and it's heated in this controlled water bath. The gel holds heat incredibly well and can maintain a therapeutic temperature of about 40 degrees Celsius for like 30 minutes.
So it's like a portable sauna for your aches and pains.
That's a fun way to think about it. And what's neat is that these packs can be like contoured to fit different body parts, so they're incredibly versatile.
Very handy. What about infrared rays? Those sound a bit more high tech.
They are. Infrared therapy uses this specific band of light that, well, we experience it as heat. This heat, it comes from an artificial source, which means you can really control the intensity and how long the treatment lasts.
So it's like a targeted beam of warmth.
Precisely. And what's great is there's no direct pressure on the body, making it really comfortable for the patient. Plus, you can actually see the area being treated, so you can make sure the heat is being applied safely and effectively.
It's like having a window into the healing process.
Yeah.
Okay, last but not least, tell me about paraffin wax therapy. I've heard of it, but not really sure what it involves.
This one, it's particularly popular for treating smaller areas like your hands and feet. You dip the affected area into a bath of melted paraffin wax. It's been carefully mixed with liquid petroleum at a specific ratio to make it more pliable and enhance its therapeutic properties.
So it's like a warm, soothing wax bath.
You could say that. Paraffin wax, it absorbs and retains a lot of heat, which makes it really effective for relieving pain and stiffness deep within the tissues.
So it's like a deep, penetrating heat treatment.
Yeah.
Perfect for those stubborn aches and pains.
Exactly. Now let's switch gears and talk about deep heating agents. Unlike those superficial ones, these agents use either electromagnetic or mechanical waves to deliver heat to those deeper tissues.
Okay, now we're talking about invisible forces. Electromagnetic waves, huh? Tell me more.
Yeah, electromagnetic waves. Imagine them as these invisible waves of energy that can penetrate deep into your body. They generate heat through the resistance they meet in the tissues. Two common examples are shortwave diathermy and microwave diathermy.
Wow, so it's like using energy beams to heat up your muscles from the inside out. What's the difference between shortwave and microwave diathermy?
They mainly differ in the frequency of the electromagnetic waves. Shortwave diathermy works at a frequency of 27.112 megahertz, while microwave diathermy, it's at a more limited frequency of 2.450 Messier range, which translates to a wavelength of 10 to 12 centimeters.
Okay, so both are using electromagnetic waves, but they're tuned to different frequencies, like radio stations.
That's a great way to think about it. And just like different radio stations broadcast different things, these different frequencies have varying effects on your body. Shortwave diathermy, it's particularly effective for treating deep muscle, tendon, and joint stiffness. Especially helpful for post-fracture contracture, where tissues around a healed fracture, they get tight and restrict movement.
So it's like loosening those tight restrictions, restoring that fluidity of movement.
Exactly. Now, it's important to remember that shortwave diathermy isn't for everyone. For instance, patients with implants, like pacemakers, can't have it. The electromagnetic waves could interfere with those devices.
That's a really crucial point about safety. Now, what about microwave diathermy? What are its strengths?
Microwave diathermy, it's a lot like shortwave diathermy in terms of its clinical applications. It's used for similar conditions, but might be preferred for certain areas or for people who don't tolerate shortwave well.
So it's another tool in the physiotherapist toolkit, allowing them to personalize the treatment. You mentioned deep heat can also be generated using mechanical waves. I'm curious about that. What are they, and how do they work their magic?
A great example is ultrasound therapy. Instead of electromagnetic waves, it uses high-frequency sound waves. The ones above human hearing range, actually. They generate heat within the tissues.
Sound waves, that's pretty incredible. So it's like using sound for a deep tissue massage.
That's a good way to think about it. The therapeutic range is usually between 1 and 3 megahertz. These high-frequency sound waves, they cause vibrations in the tissues, and that generates heat and promotes a bunch of therapeutic effects.
It's like a symphony of sound waves working their magic. What conditions is ultrasound therapy commonly used for?
It's really versatile, often used for soft tissue and ligament injuries, scar mobilization, and edema reduction. Think of it as breaking up scar tissue, reducing swelling, and promoting healing deep within the tissues.
It's amazing how many different approaches there are to, you know, promote healing and restore function. We've explored the warm and fuzzy side of things. But now I'm curious about the other end of the spectrum, cold therapy, also called cryotherapy. I'm guessing this involves, well, ice.
You got it. Cryotherapy is all about applying cold to your tissues after an injury. The goal is to lower your skin temperature to around 10 degrees Celsius. It's like hitting the brakes on the inflammatory process.
So the opposite of heat therapy. But why would you want to cool things down after an injury? Doesn't that seem a little counterintuitive?
It might seem that way at first, but cold therapy has its own unique benefits. Remember how heat causes those blood vessels to dilate? Well, cold does the opposite. It causes vasoconstriction. Think of it like narrowing those highways to reduce blood flow to the area.
Okay, so it's like controlling the traffic flow. Prevents too much swelling and inflammation.
That's the idea. Reducing blood flow helps minimize swelling and that buildup of fluids that can lead to pain and stiffness. It also slows down those metabolic processes in the area, which further reduces inflammation.
So it's like you're putting the injured area on ice, like preserving it. What kind of conditions benefit from cold therapy?
Cold therapy is very versatile. It's often used for a wide range of conditions, acute and chronic, actually. It's a go-to for managing pain, swelling, muscle spasms, and inflammatory conditions like strains, sprains, contusions, bursitis, tenosynovitis, and tendinitis.
Yeah, it sounds like a real jack of all trades. But I imagine, just like heat therapy, there are times when cold therapy isn't appropriate.
Absolutely. Just like any therapy, it has its contraindications. For example, you shouldn't use it on areas with bad circulation, like in Raynaud's phenomenon or peripheral vascular disease. It's also not suitable for people who are hypersensitive to cold, those with skin anesthesia, open wounds, certain skin conditions, or infections.
Makes sense. You wouldn't want to put ice on an open wound. So how does cold therapy work? How does it actually reduce pain and inflammation?
Well, the mechanisms are, they're pretty complex, but we can break it down. Cold therapy reduces pain by slowing down nerve conduction velocity. Basically, it makes it harder for those pain signals to get to your brain, and it increases your pain threshold so you're less sensitive to pain.
So it's like turning down the volume on those pain signals.
Exactly. On top of that, cold therapy can reduce spasticity, which is that involuntary muscle tightness, and it can inhibit muscle contraction, which helps those muscles relax.
So it's like hitting the pause button on those overactive muscles, letting them chill out, literally. What about swelling? How does cold therapy address that?
Remember vasoconstriction, the narrowing of blood vessels. That's key for reducing swelling. By constricting those blood vessels, cold therapy limits how much fluid can leak into the tissues, which prevents that swelling.
So it's like tightening the pipes to stop leakage. That's a great visual. Now, what are some ways to apply cold therapy? I'm thinking of those classic bags of ice, but are there other methods?
Oh, absolutely. There are a ton of tools for cold therapy, each with its own advantages and uses. We have ice towels, ice packs, immersion baths, ice cube massage, cold compression units, ice spray, and even contrast baths where you switch between cold and warm water.
So it's about choosing the right temperature and delivery method, depending on the injury and what the person needs.
Precisely. And speaking of tailoring treatment to individual needs, let's move on to another interesting aspect of physiotherapy, pain modulation.
Pain modulation, that sounds a little mysterious. Is this like mind control for pain?
Not quite mind control, but it does involve understanding how those pain signals are processed in your body and finding ways to, well, influence them to reduce how you feel the pain.
Okay, I'm all ears. Tell me more about this pain modulation magic.
A key concept here is something called the pain gate theory. It suggests there's a kind of gate in your spinal cord that controls the flow of pain signals going to your brain.
Okay, I'm visualizing this gate, what opens and closes it.
Think of it this way. You have different types of nerve fibers carrying signals from your body to your spinal cord. Large afferent fibers carry signals related to touch, pressure, vibration, while small nociceptive fibers carry those annoying pain signals. Now, when the large afferent fibers are stimulated, they can essentially close the gate, making it harder for the pain signals to get through to your brain.
So it's like creating a traffic jam of good signals to block the bad ones.
That's an excellent analogy. There's another layer to this, though. Signals coming down from your brain, specifically from the cerebral cortex and midbrain, they also play a role in modulating pain.
So it's not just what's happening at the injury, but also how your brain interprets and responds to those signals.
Exactly. And this understanding of pain modulation has led to the development of different therapies. One you might have heard of is transcutaneous electrical nerve stimulation, or 10NS for short.
Yeah, 10NS. I've seen those those little electro pads that people wear. How do they work with this pain gate theory?
TNS is a form of electroanalgesia, which means using electrical stimulation to relieve pain. It works by stimulating those large efferent nerve fibers we talked about, which helps close the pain gate and reduce the transmission of those pain signals to your brain.
Ah, so it's like giving those good signals a boost to overpower those pain signals. That's pretty clever. What kinds of conditions can tendon-S be used for?
It's used for a surprising number of conditions, including low back pain, arthritic pain, neurogenic pain, bladder incontinence, post-surgical pain, and chronic musculoskeletal pain.
Wow, that's quite a list. So it's a good tool for managing both acute and chronic pain.
hmm
Are there different types of TNS?
There are two main types, high TNS and low TNS. Each one has its own characteristics, and they're used for different things.
Okay, so it's like choosing the right frequency and intensity depending on the type of pain and how severe it is.
Exactly. Now, another type of electrotherapy that's frequently used is interferential therapy, or IFT.
IFT, okay, another acronym. What's the deal with IFT?
IFT is similar to ENS, using electrical stimulation to modulate pain, but it uses a slightly different type of current. It's often used for conditions like rheumatism, arthritis, muscle sprains, neuralgia, and sports injuries.
So another weapon against pain. It sounds like physiotherapists have a lot of techniques. What about therapeutic exercises? I imagine those are pretty important for recovery.
Absolutely. Therapeutic exercises, they're the bread and butter of physiotherapy. There's a saying in physiotherapy, an unused muscle loses strength at a rate of 5% per day to 8% per month. That really highlights how important it is to keep those muscles moving and working even after an injury.
Wow, that's a bit scary to think about. Use it or lose it, basically.
Exactly. Therapeutic exercises are all about restoring that pain-free movement and function we talked about earlier.
Yeah.
Getting those muscles firing, those joints moving, getting those bodies moving again.
So what kinds of exercises are we talking about? Are we talking about hitting the gym and like lifting weights?
It can be anything from very gentle movements to more challenging exercises. It all depends on the person's condition and what stage of recovery they're in. We can generally categorize therapeutic exercises as active or passive.
Okay, active versus passive. What's the difference?
Active exercises are where the patient, they're actively contracting their muscles to do the movement. These are usually used after trauma, surgery, or if they've been immobilized in a cast.
So it's about getting those muscles working again.
Exactly. Passive exercises are when the movement is done by the therapist or maybe a machine,
Right.
and the patient isn't actively contracting their muscles.
So it's like assisted movement to help keep the joints mobile and prevent them from stiffening up.
Precisely. Passive exercises are often used for conditions like polio, nerve palsies, stroke, where the patient might not be able to move the limb on their own. Now, within active exercises, you have different types, including strengthening exercise.
Strengthening exercises. Those sound like they're all about building those muscles back up.
You got it. Strengthening exercises are designed to increase muscle strength, so the amount of force a muscle can generate, and also improve muscle coordination.
Sounds like a great way to get back in the game after an injury. Are there different types of strengthening exercises?
There are three main types: isometric, isotonic, and isokinetic. Isometric exercises are muscle contractions without any movement at the joint. Imagine pushing against a wall. You're engaging your muscles, but you don't actually see any movement.
Right, like a wall sit,
Yeah.
where you're holding that squat position against a wall.
Exactly. Isometric exercises are good for building strength and endurance. They're often used early in rehabilitation when a joint might be too painful or unstable to move.
So it's a safe and effective way to get those muscles working and rebuilding strength, but without putting too much stress on the joints.
Exactly. Now, isotonic exercises, which are also called dynamic exercises, involve muscle contractions with joint movement. These are your classic weightlifting exercises, like bicep curls, squats, and lunges.
Isotonic exercises. Those are the ones that get you sweating and building those muscles.
That's right. They're great for building strength, power, and endurance. They're usually incorporated in the later stages of rehab once the joint is strong enough for movement and resistance.
So it's like a gradual progression from those isometric holds to those dynamic movements as the body heals.
Exactly. And then there are isokinetic exercises, but we'll save that for another time.
Okay, we'll save that for another deep dive. Before we move on, I'm curious about aquatic physiotherapy. I've heard of this, but not sure what it is. Sounds pretty relaxing, though.
It can be. Aquatic physiotherapy, or hydrotherapy, is basically physiotherapy that takes place in a warm water pool, usually around 34 degrees Celsius.
So it's like doing your exercise in a giant warm bath.
You could say that. The warm water has lots of therapeutic benefits. It relaxes muscles, reduces pain, increases blood flow, and it also creates a buoyant environment, which takes the weight off your body, reduces stress on your joints, and allows you to move more freely.
Makes sense. It's like taking the pressure off, allowing your body to move more freely.
Exactly. That's why aquatic therapy is particularly good for people who have trouble with land-based exercises because of pain, limited mobility, or if they have trouble bearing weight.
So it's like a gentle and supportive environment for healing.
Yeah.
What kind of conditions can benefit from aquatic therapy?
It's often used for a range of conditions like arthritis, back pain, post-surgical rehab, neurological conditions, and chronic pain conditions like fibromyalgia.
Wow, it sounds incredibly versatile. Are there any risks or considerations with aquatic therapy?
It's generally very safe, but there are a few things to keep in mind. For example, if you have open wounds, certain skin conditions, or uncontrolled seizures, you should avoid it.
So always best to check with a qualified healthcare professional first.
Absolutely. Speaking of safety, there's another crucial point about aquatic therapy.
I'm all ears. What is it?
It's super important to have a qualified physiotherapist present during those aquatic therapy sessions.
Why is that so important?
Well, for one thing, they can make sure the exercises are being done correctly and safely. They can also give you guidance and support, helping you get the most out of your therapy session.
So it's not just about splashing around in a pool. It's about having a professional there to guide and supervise.
Exactly. Now, before we move on from aquatic therapy, I want to talk about a fascinating concept related to hydrotherapy, buoyancy.
Buoyancy, that's the force that makes things float, right?
Precisely. When you're submerged in water, you feel an upward force that counteracts gravity. That's buoyancy in action, and it has some amazing therapeutic implications.
Okay, I'm intrigued. How does buoyancy help with aquatic therapy?
Well, it reduces the effective weight of your body. This makes it easier to move and exercise without putting too much stress on your joints. Think of it as a form of weightlessness, letting you move more easily and fluidly.
So it's like taking the pressure off those achy joints, allowing them to move freely without pain.
Exactly. That's why aquatic therapy is so beneficial for people with conditions like arthritis, where joint pain and stiffness can make land-based exercises really tough.
It's amazing how something as simple as buoyancy can have such profound therapeutic effects.
It really is. And speaking of profound effects, let's move on to another exciting aspect of physiotherapy, manual therapy.
Manual therapy, that sounds interesting. Is this where the physiotherapist gets hands-on?
You got it. Manual therapy is a whole range of hands-on techniques we use to assess and treat musculoskeletal dysfunction.
So it's like a physical conversation between the therapist and the patient's body.
That's a beautiful way to put it. Through touch and precise movements, the therapist can find those areas of restriction, tension, and pain.
So it's like detective work, but using touch as the main tool.
Exactly. And once they've found the source of the problem, they can use a variety of techniques to address it.
Okay, I want to hear more about these techniques. What are some of the common methods used in manual therapy?
There are a lot of different techniques, each with its own focus and benefits. Let's start with soft tissue mobilization.
Soft tissue mobilization, that sounds like it's all about the muscles, tendons, and ligaments.
You're on the right track. It involves various hands-on techniques to release tension, improve circulation, and restore optimal function to those soft tissues.
So it's like a deep tissue massage, but with a therapeutic purpose.
That's a good analogy. Therapists may use their hands, fingers, elbows, or even specialized tools to apply pressure, stretch, and manipulate those tissues.
It sounds very hands-on and personalized.
It is. And the great thing is that it can address so many issues, from muscle tightness and trigger points to scar tissue restrictions and fascial adhesions.
Fascial adhesions. Those sound a little scary. What are they?
Fascia is a thin, strong layer of connective tissue that surrounds and supports your muscles and organs. It's like a web holding everything together.
Okay, I'm picturing that. So what are fascial adhesions?
Sometimes because of injury, inflammation, or even bad posture, the fascia can become tight, restricted, or even stuck to things near it. Those are fascial adhesions, and they can limit movement, cause pain, and lead to a whole bunch of other problems.
So it's like having knots or tangles in that web of connective tissue.
That's a great visualization, and soft tissue mobilization can be really effective at releasing those adhesions, restoring that smooth, gliding motion to the tissues.
It's amazing how connected everything is in the body.
Mm.
So besides soft tissue mobilization, what are some other some other manual therapy techniques?
Another one is joint mobilization.
Joint mobilization. That sounds like it's about those, those creaky, stiff joints.
You got it. Joint mobilization is applying gentle, rhythmic movements to a joint to restore its normal range of motion and reduce pain.
So it's like gently encouraging the joints to move more freely.
Exactly. The therapist might use their hands to apply specific glides, distractions, or rotations to the joint, depending on the type of restriction and the desired outcome.
It's like a gentle persuasion, coaxing those joints back into their proper alignment.
That's beautifully put. Joint mobilization can be incredibly effective for addressing joint stiffness, pain, and limitations in movement.
So it's like restoring that smooth, fluid motion that lets us move gracefully and easily.
Exactly. Now, another technique that's often used with joint mobilization is muscle energy technique, or MET for short.
MET2. Okay, another acronym to remember. What's so special about MET?
MET is really interesting because it involves the patient actively participating. It's based on the idea that a muscle that's been contracted will relax more fully afterwards.
So it's like using your body's own reflexes to relax and restore balance.
Precisely. The therapist will guide you through specific movements, asking you to contract and relax certain muscles in a controlled way. This helps to lengthen those shortened muscles, restore proper alignment, and improve your overall movement patterns.
That's like a dance between the therapist and the patient's body.
That's a beautiful analogy. Now, let's move on to another interesting manual therapy technique, strain counterstrain.
Strain, counterstrain. Sounds like it's about those lingering strains and aches.
You're close. It's a gentle, indirect technique that focuses on finding and releasing those tender points in your body.
Tender points, those are like those little knots of tension you sometimes find when you massage a muscle, right?
Exactly. Those tender points often line up with areas of muscle tightness or fascial restriction.
So how does strain, counterstrain actually address those tender points?
The therapist will gently position your body in a way that shortens the muscle or fascia related to the tender point. It basically takes the strain off that area.
So it's like finding the position that's easiest for those tight tissues?
Precisely. They'll hold this position for a certain amount of time, usually around 90 seconds, which allows the tissues to relax and release.
So it's like gently coaxing those tissues to let go of their tension and become more balanced.
That's a great way to put it. Strain counterstrain can be remarkably effective at reducing pain, improving mobility, and restoring your overall function.
It's amazing what you can accomplish with just with skilled touch and gentle movements.
It really is. Now let's explore another fascinating aspect of manual therapy, myofascial release.
Myofascial release. Sounds like that's all about that web of connective tissue, the fascia we were talking about earlier.
Absolutely right. Myofascial release is a specialized technique that focuses on releasing those restrictions and adhesions in the fascia.
So it's like smoothing out those wrinkles and knots in the connective tissue.
That's a good analogy. The therapist will use their hands to apply sustained pressure to specific areas of the fascia, gently stretching and releasing those restrictions.
It sounds subtle, but powerful.
It is. Myofascial release can have a huge impact on the body, improving posture, reducing pain, increasing range of motion, and even promoting relaxation and well-being.
It's amazing how interconnected everything is. Releasing tension in one area can have effects throughout your whole body.
Exactly. Now let's delve into another intriguing manual therapy technique, craniosacral therapy.
Craniosacral therapy. That sounds like it's all about the head and the spine.
You're on the right track. It's a gentle, hands-on technique that focuses on the craniosacral system that includes the bones of your skull, your spine, and your sacrum.
So it's like a very delicate form of manual therapy.
Precisely. The therapist uses their hands to apply subtle pressure to the skull, spine, and sacrum, listening for and addressing any imbalances or restrictions in what's called the craniosacral rhythm.
Craniosacral rhythm, what's that?
The craniosacral system has this subtle rhythmic movement that's completely separate from your heartbeat and breathing. It's thought to reflect the flow of cerebrospinal fluid, the fluid that surrounds and nourishes your brain and spinal cord.
Okay, so craniosacral therapy is like tuning into that subtle rhythm and making sure it's flowing smoothly.
That's a beautiful way to describe it. By addressing restrictions in that rhythm, craniosacral therapy can have a wide range of benefits, including reducing pain, improving sleep, relieving stress, and enhancing your overall well-being.
It sounds incredibly relaxing and therapeutic. What kinds of conditions benefit from craniosacral therapy?
It's often used for headaches, migraines, neck pain, back pain, TMJ disorders, and even conditions like anxiety and depression.
It's amazing how such a gentle technique can be used for so many things.
It is. Now, before we wrap up manual therapy, I want to mention one more technique, massage therapy.
Massage therapy, that's a familiar one. Most of us have experienced the benefits of massage, right?
Exactly. Massage therapy covers a whole range of techniques that involve manipulating the soft tissues of your body using different amounts of pressure, friction, and movement.
So it's about kneading, stroking, manipulating those muscles to release tension, improve circulation, and promote relaxation.
Precisely. And while massage is often linked to relaxation and stress relief, it can also play a big role in physiotherapy treatments.
Oh, how so?
While massage can be used to prepare your muscles, for exercise, it can reduce soreness after workouts, improve flexibility and range of motion, and even manage pain and inflammation.
So it's like a multi-purpose tool that can work alongside those other physiotherapy techniques.
Exactly. Now, before we move on, I want to circle back to something we touched on earlier, patient education in physiotherapy.
Right, you mentioned that physiotherapists aren't just, hands-on healers, they're also educators, right?
Right.
They help empower patients to take an active role in their own recovery.
Exactly. Knowledge is power, especially when it comes to, healing and getting back on your feet.
Makes sense.
Physiotherapists, they take the time to really educate their patients about their condition, the reasons behind their pain or dysfunction, and why the treatment plan is what it is.
So it's not just about, passively receiving treatment. It's about understanding the why behind the what.
That's it, exactly. This helps patients make informed decisions about their care and to really get involved in the healing process.
It's like a partnership then, a journey towards recovery together.
That's a great way to put it. Now, let's focus on another crucial aspect of physiotherapy, therapeutic exercises. We touched upon this earlier, but I want to go a bit deeper into how exercise can specifically help restore function and improve your overall well-being.
Okay, sounds good. We talked about active and passive exercises before, and I'm curious to know more about the different kinds of active exercises.
Well, one of the most basic types is range of motion exercise. As the name suggests, it's about moving a joint through its full range of motion.
So it's like taking your joints for a test drive, making sure they can move freely.
Exactly. Range of motion exercises can be active, where the patient moves the joint themselves, or passive, where the therapist or even a machine helps with the movement.
And these exercises are important for keeping those joints flexible and preventing stiffness, right?
Absolutely.
Yeah.
They keep the joints lubricated, the muscles nice and supple, and the connective tissues healthy.
So it's like keeping those joints well-oiled and moving smoothly.
That's a great analogy. Another important type of active exercise is stretching. Stretching involves lengthening a muscle or group of muscles to improve flexibility and range of motion.
Stretching, that's something we all know, right? Whether it's touching your toes or doing some yoga.
Exactly. And while stretching is often linked to fitness and sports, it plays a crucial role in physiotherapy as well.
How so?
Well, stretching can help relieve muscle tightness, improve your posture, prevent injuries, and even reduce pain.
So it's not just about being flexible, it's about overall function and well-being.
Precisely. Now, there are different types of stretching, each with their own advantages and uses. One common type is static stretching, where you hold a stretch for a while, usually 30 to 60 seconds.
Static stretching, the classic hold the stretch technique. I remember doing those in gym class.
Exactly. Static stretching is great for improving flexibility and increasing range of motion. Another type is dynamic stretching, where you move a joint through its range of motion in a controlled and fluid way.
Dynamic stretching, that sounds a bit more active and engaging.
It is. Dynamic stretching is often used as part of a warm-up routine to prepare your body for exercise. It increases blood flow, loosens up those muscles, and improves coordination.
So it's like gently waking up those muscles, getting them ready for action.
Exactly. Now, another type of stretching often used in physiotherapy is proprioceptive neuromuscular facilitation, or PNF for short.
PNF, okay, that's a mouthful. What's so special about PNF stretching?
PNF stretching combines stretching with muscle contractions to boost flexibility and improve range of motion. It's a bit more advanced and often requires a therapist's guidance.
So it's like taking stretching to the next level, using those muscle contractions to deepen the stretch.
Precisely. Now, let's move on to another key aspect of therapeutic exercise. Strengthening exercises. We briefly touched on these before, but let's explore the different types and their benefits in more detail.
Sounds good. We talked about isometric, isotonic, and isokinetic exercises. Could you Could you remind me what those are all about?
Sure. Isometric exercises involve muscle contractions without any movement at the joint.
Hmm.
It's like trying to push against something that won't budge. Your muscles are working, but there's no visible movement.
Right, like that wall sit we talked about, holding that squat position against a wall.
Exactly. Isometric exercises are great for building strength and endurance, and they're often used early on in rehab when a joint might be too painful or unstable to move.
So it's a safe way to activate those muscles and start rebuilding strength, but without putting too much stress on the joints.
Precisely. Now, isotonic exercises, or dynamic exercises, involve muscle contractions with movement at the joint. These are your classic weightlifting exercises like bicep curls, squats, lunges, things like that.
Isotonic exercises, those are the ones that really get you working, building muscle.
That's right. They're great for building strength, power, and endurance. They're usually included later in rehab when the joint is strong enough to handle movement and resistance.
So again, a gradual progression from those isometric holds to the dynamic movements as the body heals.
Exactly. And then you have isokinetic exercises, but that's, well, we'll save that for another discussion.
Okay, we'll put that on the list for a future deep dive. Now let's talk about assistive devices. Those are things like crutches, canes, and walkers, right?
You got it. Assistive devices are tools that help people with mobility issues get around more easily and safely.
So it's like they're extensions of the body, right? They provide support and stability when you need it.
That's a great way to put it. Physiotherapists are experts at assessing what a person needs and recommending the right assistive device for them.
So it's not just about grabbing any old cane or walker. It's about finding the right tool for the job.
Exactly. And once they've chosen the device, the physiotherapist will show them how to use it safely and correctly.
So it's about empowering them to use it confidently.
Precisely. Now, assistive devices can range from simple things like canes and walkers to more complex things like wheelchairs and scooters.
So there's a whole range to choose from depending on what the person needs and how mobile they are.
Exactly. And the choice depends on several things, including the nature of their mobility challenge, their strength and balance, and even their environment.
So it's really tailored to each person, taking their individual needs into account.
Absolutely. Now, let's look at some specific examples, starting with walking aids.
Okay, sounds good. Let's start with canes. I've always wondered, what's the right way to use a cane?
That's a great question. Generally, you want to hold the cane in the hand opposite the side that needs support. So if your right leg is weaker, you'd hold the cane in your left hand.
Okay, so it's about counterbalance, creating stability by distributing the weight evenly.
Exactly. When you're walking with a cane, you want to move the cane forward at the same time as the weaker leg. This helps create a smooth, rhythmic gait.
So it's like having a partner, stepping in sync to provide support.
That's a fun way to think about it. Now, let's move on to walkers. Walkers offer more support than canes and are often used by people who struggle with balance or who need help with bearing weight.
Walkers, those are the four-legged frames, right? The ones people use to steady themselves.
Exactly. There are different types of walkers, too. You have standard walkers, which you have to lift and move forward with each step, and then rolling walkers, which have wheels, so you can just push them.
So it's like choosing between manual and automatic, depending on your strength and how mobile you are.
That's a great analogy. And just like cars, walkers come with different features like seats for resting and baskets for carrying things.
So they're like mobile command centers for people with mobility challenges.
You could say that. Now, let's move on to crutches. Crutches provide even more support than canes and walkers and are often used by people who can't bear weight on one or both legs.
Crutches, those are the ones you tuck under your arms, right? To swing yourself forward.
Exactly. You have two main types. Axillary crutches, the classic ones that go under the arms, and forearm crutches, which have a cuff that goes around the forearm.
So it's like choosing between an underarm grip and a forearm grip, depending on what's more comfortable for you.
Exactly. And just like canes and walkers, there's a specific way to use crutches safely and effectively.
So it's not just about hopping around. It's about using them in a way that helps you heal and prevents further injury.
Exactly. Now, moving beyond walking aids, there are also devices for people who use wheelchairs.
Wheelchairs, they're like mobile thrones, providing freedom of movement for people with more significant mobility challenges. Well, this has been an incredible journey through the world of physiotherapy, exploring its many facets and its profound impact on human health and well-being.
It's amazing how much this field encompasses, from pain management and rehabilitation to injury prevention and performance optimization.
It truly is. And it seems like the possibilities within physiotherapy are constantly expanding. with new research and innovations emerging all the time.
Absolutely. Physiotherapy is a dynamic and evolving field, constantly seeking new ways to enhance human movement and improve quality of life.
That's inspiring to hear. Well, before we wrap up this deep dive, I want to express my gratitude for your expertise and insights.
It's been a pleasure sharing this journey with you.
And to our listeners, we hope this deep dive has sparked your curiosity about the incredible world of physiotherapy. Whether you're seeking relief from pain, recovering from an injury, or simply striving to move with more ease and confidence, physiotherapy can offer a wealth of tools and strategies to empower your journey. Until next time, keep exploring, keep moving, and keep striving for your optimal life.